Good evening, Beverly.
Good evening to you.
How are you tonight?
Just fine, thank you.
Great. We're here to talk about your dental implants.
Great.
Why don't you tell us a little bit about them?
Well, I have two on the lower left, and they're great. I love them.
Now, these are two individual single tooth replacement implants, is that correct?
Right, two individual implants. I was missing 3 teeth on the lower left. And first we were going to do one implant and bridge it to a permanent tooth. And it went so well we decided not to do that, and we added another implant about 6 months later. So I actually have two implants that are holding two permanent, or two cap teeth there. And they're not attached at all to a permanent tooth.
Great. So we've eliminated then the attachment of
Right.
the bridge to another natural tooth.
Right. They're independent.
How do they function for you?
Just like a normal tooth. They're great.
So as well as your natural teeth do?
Oh, yes, definitely.
What did you do before you got your dental implants? What was your situation? Did you have a partial bridge?
No, I did not have a partial, but I needed one. I had a tooth in the back which had to be extracted, which at that point I was going to have a partial made, which I did not want to do. And Dr. Barbanel spoke to me about the new procedure that he was going to try, which was dental implants, and I happened to be his first patient.
You were Dr. Barbanel's first implant patient, and you lived to tell about it.
Correct.
Great. You mentioned a couple times that you feel your implants are as comfortable and as natural as your natural teeth. Are you even aware that you have implants at this point?
No. There's no difference between the implant and the teeth on the other side.
Great. So it's as if they're your natural teeth and you don't even think about the implant.
That's correct.
Good. What about any post-operative pain after you had the implants?
None. Some swelling. In fact, I went back to work the next day. I had it done late in the evening and I worked the next day.
Great, great. Now, Dr. Barbanel did the implants only, and then he worked very closely, I guess, with your dentist to then put the actual caps on the implants.
That's correct.
Was there any difficulty at all in coordination of the implant procedure with the capping procedure with your dentist?
No, I've had caps done on just a regular permanent tooth that's in my mouth, and there was no difference between doing a permanent tooth capping than it was to cap the implants. The only difference was that a lot of people looked in my mouth. All the technicians and the hygienist, anybody that was in the office, you know, wanted to get a shot at it. Because they had not seen, just to see the implants, most of the people had not seen them.
And I take it your dentist hadn't seen one either?
No, I was the first one that he had worked on.
Beverly, what about the insurance coverage for the procedure?
They did not cover the implants per se, but they did cover a portion of the capping as if they were doing a regular partial. They paid that portion of it.
So then they paid the allowable amount for a partial denture toward the implant procedure?
That's correct.